Good afternoon and hello, everyone. Welcome to today's session, Healthy Influence, collaborating with social media influencers on health-related campaigns. My name is Elizabeth Breidenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event along with my division colleagues. At this time, I'm going to turn things over to my colleague, Ellen, who will be introducing today's speakers and setting the stage for you. Ellen, the floor is yours.
Thank you very much. I'm Ellen Robinson. I'm with our Clinical Affairs Division at NAC, and I'm very thrilled to have everyone on the call today to talk about influencer marketing. And influencer marketing has been really successfully used by health departments to disseminate accurate public health messages, including about COVID-19 and building vaccine confidence, but it's not as widely used in community health centers. We were very lucky to have the support of a CDC grant, and we were able to contract with Gevin Communication and their social impact team to pilot NAC's first ever influencer marketing campaign in partnership with 3 community health centers. The goal of our pilot project was threefold. First, we wanted to combat the spread of misinformation via the social media platforms of the influencers, build capacities of 3 health centers to plan and execute what we call micro-influencer programming as part of their overall effective communication strategies, and gain experience in forming partnerships with these local influencers. And third, to assess and broadly share the knowledge and learnings with you across the country so that you all can learn to use this marketing channel and incorporate it into your communication strategies. Today, we're going to hear from the experts. Certainly not me. I'm still learning about influencer marketing, but those who work all the time with influencers on all sorts of health campaigns. Our colleagues at Gevin Communication, Jen Vento and Brandy Riley. They're going to go over campaign overview, share insights, and influencer feedback from the pilot. We are also lucky enough to hear from Jeff Harry, an influencer who participated in our pilot campaign. Our hope is that by sharing our learnings and experiences, we can encourage health centers to do their own influencer marketing pilot program. We will put in the chat our 2 hot off the press documents to help you start or continue your journey in influencer marketing. A huge thank you and appreciation to our 3 participating health centers in the pilot: Native American Health Center in Oakland, California, Roanoke Chowan Community Health Center in Ashoki, North Carolina, and Valley del Sol Health Center in Phoenix, Arizona. These sites were selected based on their geography, current engagement on social media, and influence and interest in influencer marketing. Now I'll turn it over to my colleagues at Gavin Communication, Jen and Brandy.
Great. Thank you so much, Ellen. It's wonderful to be here with you all today to talk about some of our learnings from the pilot, as well as to talk about how you might incorporate influencers into your day-to-day health center communications. So if you could advance to the next slide. Great. Okay, so first we'll give you a quick overview of the campaign. For this campaign, we collaborated with a team of influencers who shared original content and storytelling on their social feeds over a 3-week period this past spring. And the goals for the influencer team were to use their platforms to educate their respective audiences about their local health center and its services, with a focus on COVID vaccination and services, to encourage their followers to get vaccinated or boosted, and or vaccinate and boost their children. And finally, to combat false and harmful mis and disinformation about the vaccine with factual science-based information. So we're going to get into the specifics about how influencers were selected. But first, I want to take you on a little high-level look at the process. And while it's specific to the campaign at hand, this process really covers the basics for planning most social media influencer campaigns. So if you could advance to the next slide. Thank you. Okay, so a quick overview here. But first, we wanted to prepare. We spoke to the participating community health centers to understand their demographic characteristics in terms of the surrounding community, any kind of key unique messages that they wanted to communicate within the campaign, and the measurements of success. And measuring success could really include asking people to visit a link, to sign up for something, to share a social media post, whatever impact you're seeking to make it. You want to make sure that you can determine how to quantify it. And for this pilot campaign, we look to introduce community health center COVID services, and share science-backed information. And as a result, we measured how much audiences engaged with the content through the number of likes, comments, shares, and video views. The second step of the process is to identify the influencers that we felt would best carry the message. And Brandy will discuss that in more detail. But we crafted an ask to each of them and reached out. And once the influencers confirm their interest, we usually send a short agreement to memorialize and to make sure that we're both on the same page in terms of deliverables. Influencers then participated in a virtual briefing call to learn more about the mission of community health centers in general, and then the health centers we're working with in particular, also their approach to COVID services and the importance of fighting misinformation with science-based facts. And after the briefing, each influencer was provided with a toolkit, which provided, the basic messaging guidelines, access to social media graphics to share, and an outline of the timing and deliverables. Fourth, we monitored the hashtag, we monitored the post and tracked the posts during the campaign window and tracked engagement. And finally, we aggregated those metrics, and we also dug into the comments from users to get a sense of, how they responded to the content, what was the sentiment. And we asked influencers to share their feedback on participating in the campaign. And all that information was distilled to develop a set of key learnings. And we'll talk about those a little bit later. So I'm going to hand it over to Brandy now, who's going to talk a little bit more about sourcing influencers.
Awesome. Thank you, Jen. Could we please go to the next slide and the one after that? So this is a quote I wanted to share. It's from Jamie Zamparelli. She's one of our North Carolina influencers. And she says, as a mom, I want to do everything in my power to keep my children safe and healthy. We all need to be aware that there is a lot of misinformation shared on social media and the internet about COVID-19 and the vaccine. This is actually a quote that comes from some of the content Jamie created for this campaign. And I just think it's such an impactful statement and gives you an idea of why these type of programs are so important and timely. So if we can go to the next slide. What is an influencer? So influencer, when we talk about social media influencer, or when we talk about influencers, we're typically referring to social media. There are folks who write blogs and things like that, and we're certainly influential, but social media obviously has taken over. And so to be able to build a community and an audience on a platform like TikTok or Instagram or LinkedIn or Twitter or Facebook, Twitch, even Discord, we have people building influence on Slack. It's such a great way to share important messaging and also to build a community around important topics so that you can start to take action. It's not just sharing information, but it's also driving people to action. In this case, was driving people to know about vaccines. Remember that COVID is not over, to share information about getting children vaccinated, and also to do away with any mis or disinformation. So just from this slide, it says that social media influencers use their social media platform to share insights, perspectives, and information. They have a great reputation. People look to them for their expertise. They look to them for accurate information. It's really a big responsibility to be a social media influencer. In a public health campaign like this one, they can enhance the health center's communication outreach by bringing a personal story. And you'll see that when we share Jeff's video, that he brings himself, he brings his personality, and he disseminates the information in a way that his audience is used to receiving it. So it's a lot different than getting a PDF download, a one-sheeter, a white paper from a health center. But when you're getting it from someone that you either consider a peer, you look at as someone who is similar to you or in the same community, or that you look at as kind of a teacher, I think it is received a lot better. When influencers collaborate with credible third-party organizations and people, they become part of the choir that supports and promotes your health center's message and helps drive engagement and awareness. And I think this is really important to understand, that it has to be a partnership, because the influencers are not, well, we do have influencers who are doctors, as you will see. But they are not supposed to be the researchers. So working in collaboration, they can get the great information from you and share it out in a way that makes sense to their audiences. Could we please go to the next slide? I want to talk a little bit about how influencers are selected, and the scope of work and things that we shared with our influencers. So these were our influencers. We had a diverse group of 10 influencers in 3 states across the US. I do want to point out, we didn't put this on the slide because it's not awesome information, but the goal was to have 12, and we did have 2 people drop out. And so I want to be clear that, influencers are human, things come up. And it's always good just to kind of have a backup plan just in case the plan A falls through. But these are the influencers that we ended up with. They were super amazing. It was very exciting and interesting to select the influencers. How we did that is manually going through looking for people in the different areas. We went through their entire accounts looking for some connection to the theme that we're presenting. So yes, we have parenting influencers. Yes, we have a doctor on here. Zeal Shah is a doctor. Yes, we had nurses. Uh, Tyrese Munson is a nurse. Jeff Harry works with HR professionals. So, we have people from all different spectrums, but the one common denominator was that they had all talked about important topics, sharing information that was doing away with misinformation, whether it was about COVID or another topic. So we did that manually. We also used different platforms to look at things like their engagement. And we're not looking to see that they have hundreds of thousands of followers. We just want to make sure that when they post things, people are engaging with it. People are leaving comments or they're liking. So if you look through all of the posts for this campaign, you might not see 1,000 likes on a post, but what you will see are some very interesting and insightful comments and engagement. And if we can go to the next slide, I will share one such piece of engagement. This warms my heart every time I read it. It just I got chills the first time. My mom survived polio and tetanus before the vaccines were available. So we are so thankful for vaccines. She had tears the day she got her COVID vaccine and was so thrilled when my husband and I could get ours. This was a comment on a post on Instagram. So people are really looking at the content that these influencers are creating, and they are being moved by it. They are being moved to share their stories. They're being moved to help drive the message to even more people by sharing their experiences. So I do want to talk a little bit about the scope of work that we ask of the influencers. Because every influencer is different, we had our goal, which we definitely knew we wanted it to be an Instagram campaign because we felt like that's where people engage with this type of information a lot. And also a lot of our demographic that we're trying to reach was there. So parents with young children, that was one of our key demographics that we were looking to connect with. However, not everyone does Instagram the same. So Jeff Harry did a video. We had other folks who did carousels. We had some people who really went hard inside of Instagram stories. So for each person, after we looked at their account and we looked at where they have the most engagement, we did provide some personalization opportunities for them to be able to reach their audiences better. I think that's really important if you're going to do a campaign, is not just to have a one size fits all approach to the content, but also understand that, wow, maybe even though I can't see what's happening in the stories, I can see that this influencer is consistently in there and they're doing it. And it seems like their audience is really engaging with it. So maybe they don't have, again, 1,000 likes on their Instagram post, but inside the stories, there's so many comments, there's so much engagement, so much interaction. So please just keep that in mind. And then we wanted to make sure that we found people who were close to the centers. Here's the great thing about social media. You can do it and promote anything anywhere. I'm in Oakland, California. I could promote Arizona. I could promote Roanoke, Shawan. I could do, it's social media. But what we thought was really important was to find people who might have a better opportunity of reaching folks locally, since that's where the health centers are located. So now that is kind of like an overview of working with influencers and how we select them for the campaign. I want to get into the nitty gritty. So we are going to bring up Jeff Harry. Jen, if you don't mind introducing him.
Sure. Yes, I'm thrilled to introduce Jeff. He participated on behalf of the Native American Health Center in Oakland. And beyond being an awesome social media creator, Jeff is also a speaker. He's an HR consultant who focuses on play, which is super interesting, and a coach. So before we hear from Jeff, let's take a short look at the short video that he posted as part of the campaign on his social feeds.
We did it! COVID is over. Well, actually, it's not. What are you talking about? We don't have to wear masks in restaurants or even on planes anymore, and they're not talking about it in the news. Yeah, just because we're not hearing it in the news and there's no mandates to wear masks in certain places doesn't mean it's over. In fact, there's still searches happening and we have to be careful. Well, aren't most people vaccinated? Well, only 67% of the US is vaccinated and only 72.5% of Californians are vaccinated. And kids right now are most vulnerable. According to the CDC, 87% of the hospitalizations during the Omicron surge were unvaccinated kids. So what am I supposed to do? Get your kids vaccinated. Where? The Native American Health Center. Native American Health Center? Isn't that just for Native Americans? The Native American Health Center serves all underserved communities, and there's actually one right near Fruitvale BART. Even now, we need to continue to look out for one another.
Awesome. That was amazing. So this is some more information from Jeff. This is, you guys can see there's a comment from one of his audience members, a post that he did, and then the video with the caption. So Jeff, welcome. Thank you so much for being here.
What's up? I'm excited.
Yeah, okay. All right. So I have a few questions, and because I know you, I'm going to kind of put those questions together and just kind of let you talk, if you don't mind.
Oh, mercy. All right, let's do this.
Okay, so the questions that I have, a couple of them together. What made you interested in participating in the campaign? And then what was the approach to creating the content?
Yeah, so I'm interested in the campaign because I'd already been talking about it a lot. So a lot of my content, I wear a lot of these like wigs. I got these wigs right here. But I'm all about talking about a lot of things when it comes very like political, like challenging misinformation. That's just my jam anyway. So this campaign really spoke to me because um, I don't feel a lot of people are actually provided the proper education when it comes to this, and there's just so much crap out there. And I'm on TikTok a lot, so you just constantly are being bombarded with stuff. So when yeah, I saw this campaign, I like jumped at the chance of it. And then what was the other question that you asked? Oh, how did I come up with the concept?
Yeah.
Um, well, I think because I use humor a lot of my and wigs. I wanted the challenge. I wanted to just create the situation of me actually having a conversation with even some of the people that comment on my, on my channels, and being like, what would that conversation actually look like? And that's how I like created that one.
Awesome, awesome. We do have a question from the audience, and I'll get to that in just one second. I want to know, what was your audience's reception to the content? I mean, we see one of the comments here where people are really sharing and feel very connected to the content. But other than that, like, what sort of engagement did you get? What sort of feedback did you receive?
Yeah, a lot of people were just in support of it, of like, thank you. I have a lot of friends that are immunocompromised, right? Some of them haven't been able to like leave their house that much throughout this entire time, and my other followers don't know that. So just even having that conversation and watching people in the comments talking about that and being like, "Oh, I didn't know this." Oh, and even some of the debates where you had certain people that were like, well, I don't know, I think you're spreading misinformation. But just watching them have those debates is good because it creates a certain level of like conversation and community, because I'm always trying to foster more hard conversations so that we can actually get to a better understanding. So that's what happened, at least on my channel.
Awesome. Awesome. What have you learned by engaging with health centers as part of this work? And then I'll connect that with another question. What feedback do you have for health centers for working with influencers? What could make the relationship have even more impact?
Yeah, that's a great question. So what I learned that was great about working with the health centers is um, how much information I don't have, right? So like I'm most of the time focused on, working with organizations. So just going to the panel discussion where they presented a lot of the information, all that stuff that I'm bringing up, I didn't know that before that campaign. So the amount of education that you can provide for us is really helpful, especially when we're not coming from like a medical background. That's really helpful. As for like how it would be better to work with community health centers, just I think the more the idea of just having conversations and connections with them to understand like, okay, what is their motivation? What do they consider success? If you can communicate what success looks like to us, that's much more helpful for us than be like, okay, can we help? And if so, how can we do it in a way that's going to be effective, right? How are you measuring success? It's the amount of people that are coming to get vaccinated, the amount of people that are going to the links that you want us to promote. What do you want from us? And seeing how we can actually like fit.
Yeah, that's great. That's great. Another question from the audience. What if the conversation gets tough? How do you handle the comments?
Oh, you dive in, you sit in the awkwardness. You just sit there and
Mhm.
have it out. I mean, again, right? A lot of times, what was it? I think it was Eric Bailey who taught me this. It's just like you go into a conversation either to be right or to understand, right? And that's where we have to have that conversation. So there's certain people that are going to argue. I think this even happened in my comments where someone was just like, just going off. I'm not vaccinated. I'm not wearing a mask, blah, blah. And then I would just respond to them in a very calm and collective way, as well as other commenters would. And we're not trying to persuade that person, right? But everyone else is paying attention. I think a lot of times we don't realize how many people are actually paying attention. And the more that we can, what is someone said this to me once that it's like 10, 80, 10. Like 10 people agree, 10% of people agree with you wholeheartedly. 80% are kind of like in the middle, and the other 10% are never going to agree with you, right? But if you can focus on the 80 is like persuasive if you show up with like respect, compassion, and empathy. And as long as the followers that I have, are communicating that way, and I'm communicating that way, then I feel like we can make a really good case.
Thank you, Jeff. We want to move into talking more about working with influencers and bringing Jen back into the conversation. But I do have a question from from Tessa, Jeff, that I want to throw at you. She says, and I think this is so important, especially for health centers. How do you get over the barrier of, and this question is so perfect for you. How do you get over the barrier of your company not understanding the benefit of more fun content? I have had a hard time moving into more engaging content style from the stiff and more formal style that an older generation is used to. I feel like they think this is unprofessional when I think it offers a huge benefit.
Oh, I love this question. So I say this a lot to a lot of companies when they're like, why do you need more play? I don't understand. You need more play. And I always say the future's where people are having the most fun, right? Where was information? Where were people going for information during the pandemic? TikTok. Why were they the same place where people go dancing, right? So a lot of times think about even the information that you consume. Sometimes you're more likely to consume really complex information through you binge watching Netflix rather than someone sending you like a PDF or or you hopping on, I don't know, like watching like a really lengthy uh, YouTube conversation, right? So I think the challenge that you have to ask is how is it working now? How are we doing right now? How many people are actually consuming, our downloadable PDFs or, watching, whatever it is that we're actually producing? And why don't we just experiment? Why don't we just let's just try it. Something really small, because a lot of times that, they're worried a lot about not being professional. I totally get that, right? But if you even look at, I remember when Brene Brown did her first TED Talk, she was so worried about it not being professional. and that, that she would be mocked by so many of her professor colleagues. But look at the impact that one talk had, right? So I think when we're able to let go, be a little bit more vulnerable, and experiment and play, you'd be surprised what actually happens. And it ties right back into the idea of like the futures where people are having the most fun. People gravitate towards fun. They want to listen, but sometimes you almost need it to come in ice cream form in order for you to consume the medicine.
That's incredible. And I love that as a data person. Yeah, are people clicking? You have analytics on all of your social media accounts. Just try it. Do an A/B test. Just try it. Test it out. Test out having your, and it doesn't have to be dancing, but dancing always does get people engaging, Have your nurses dance, have your doctors do a little jig while they're sharing information. And then go to those folks who are afraid of making the change with numbers and say, look at how people are engaging. And so I want to pull everyone into the conversation now. We're going to talk about working with influencers a little bit more about the relationship structure, what type of content does well and things. But I see a question over here from Lori that I think is really interesting. And she says, has anyone actually indicated they changed their mind? I find social media facilitates talking to people and not with people. And I think that's such a great question. I do think that social media plants the seeds for a lot of people. I mean, the goal of the influencer isn't to, I always say that it isn't to necessarily sell your product. It isn't necessarily to change people's minds and get them to think the way that you want them to think, but their role is to share information, give people a different perspective, and allow humans to go off and human. They mull over it, they make changes based on new information, but it's not typical to see that happening in real time on social media underneath someone's post. You see it occasionally, but what I have seen is years later, literally years later, people coming to me and saying, hey, I know I went really hard on you with that comment you made or with that post that you shared, and I was wrong. I've had people send emails saying I was wrong. This is years later when I've already moved past the topic. So I think that thinking about influencing more as seed planting as opposed to coming with a full tree already, bloomed. Jen or Jeff, do you guys have any other feedback about that? About helping people to change their mind and the role of social media with that?
Sure, I would add that, I think anything that's looking at behavior change is a long-term play, right? So that's something, as Brandy said, you have to plant the seed and then eventually you'll get to the full tree. But those are, they're often long-term. So, and for this campaign in particular, it was about introducing the services, right? So that was, that was the main goal. But if we were to look at actually changing behavior, we would look at a long-term cadence for that, to continually reach the same audience and build on the messaging.
Yes, great.
I think
Yeah.
also a good point is for a lot of health centers as they're trying to explore whether to do this is also, are your expectations realistic? Like, what do you actually want to accomplish out of this campaign? And know that some things are doable and some things are not, right? I know that my main role in this campaign at least was to simply introduce and start to have that conversation. But if someone's like, well, I want to persuade this whole, you know, neighborhood to come and get vaccinated that has not gotten vaccinated before, it may take a lot of different experiences. They may have to see myself as well as they may have to see people from their church and their community center and a lot of different strategies in order to have impact on that specific neighborhood. So I think that's what we have to analyze is like, okay, what role can the influencer play? And then what other roles can community partners play?
Yeah, that's fantastic. And we did get a question earlier before the session started about centers using their own influence. And I think that one of the ways to approach it is to think of yourselves as information sharers, looking at TikTok and Instagram and Pinterest even for ideas about the type of content that people are engaging with. folks want to learn. I mean, people are going to university at TikTok. Like they're really going hard at learning things on YouTube. So instead of thinking about, and I know I'm the person who brought up dancing, so it doesn't necessarily have to be dancing. People just want information. People want to know, how do you clean your eyelids? Have someone demonstrate that. Even if you don't want to demonstrate it, you can just point and say, hold your eyelid down, use fresh water, use a washcloth. So thinking outside of I have to present in an influencery type way, but thinking more about like, I just want to get information out to people in a way that is easily digestible. You can absolutely do that with whatever resources you have at your center.
And I think also people have to change their perception of these different platforms, right? Like I go on TikTok. Before, when I was getting a lot of the COVID information, I was getting it from the Yale School of Medicine on TikTok, right? It was just professors on there just talking straight to the camera and providing education. And it was interesting, and they would do it in about like 1 minute. So, I think a lot of times we think the perception is that only the Kardashians and like Justin Bieber and all these other people are on it. But there's a lot of education on a lot of these different platforms, and we can't discount the power of these platforms.
For sure. For sure. Thank you. Jen, could you talk a little bit, bringing it back to this specific campaign, just talk a little bit about the relationship between the influencers and us at Gebben and NAC, and just how all of that kind of works together?
Absolutely, absolutely. And actually, if you could advance to the next slide, we do have some findings, overview findings that we want to share. If you could keep going, because I know we're actually running short on time because there's so many great questions. If you could advance again, Liz, and one more time. um, so I would say, in terms of how we all work together, you know, first, it is a partnership across the board, right? The influencers play a role in packaging the content in a way that resonates. The health centers played a role in helping determine, the key messages and defining the audience they wanted to reach. And then we played a role in kind of coordinating that with some guidance from NAC. So I would say, that process really allowed us to select people who were aligned with the content and aligned with the community, who were part of the community. And you can see that in the results. We got high, well above average engagement rates. Um, in terms of just a few other insights, the timing of the campaign was quite unique. It came at an inflection point during the pandemic, which was when mask mandates were starting to be lifted. And, I would say there was also a fair amount of conversation about vaccines prior to that. So, which is interesting because I'd say the lifting of mandates and that inflection point allowed a lot of individuals who were responding to the content really talk about their struggle to get back to normal. So it was kind of different engagement than we were expecting, but there was an opportunity for a conversation around COVID, and that is important as well. And then finally, I would say, as you can see from Jeff here, that supporting, providing support for everybody participating in the campaign is really key, especially when you're talking about a difficult subject that's very divisive, unfortunately. So, ensuring everybody feels supported with information and that they can go out, they can share information and be prepared when there is pushback, because inevitably there often is. And if you could go to the next slide, Liz. So I think these are some of the recommendations that we started getting at through the Q&A. And these are really recommendations for individual community health centers that are interested in getting started with influencers. So, it's okay to start small, I would say, and Jeff, you alluded to this before, but, think about the long term, think about how you might want to build on your messaging, and we've been talking about measurable calls to action. Really think about what you can actually measure to prove success, especially if you're looking at kind of pushing the envelope a little bit with content. You want to make sure you'll get the return on that. And then fostering relationships. And this is really, really key. And this is what Brandy was alluding to. But, you know, creators, they understand their audience, and they can really counsel on some of the best ways to reach them. And, you know, for those that are really invested in your local community, like those are the influencers that you want to find. And they may be niche, they may not have a huge number of followers, but they understand their local community in which your health center operates. So engaging with them, inviting them to events, helping them to get to know your health center, finding ways together to tell its unique story, you know, and then also engage with them on social, even when they're not creating content for the community health center. It goes a long way, you know, in building relationships. Um, and then finally, I think we're, you know, we talked a little bit about this, but see what works, you know, continue to iterate and co-create, you know, extract your learnings after each engagement. And then finally, you know, small targeted ad spends do go a long way when you're looking at, you know, hyperlocal engagement. So Brandy, I answered a lot more than your questions about relationships, but I know that there are some other items that we want to dive into deeper with Jeff, and I think we have some additional questions.
Yeah, thank you, Jen. That was all fantastic, and we got some great feedback on the side about that. Could we go up? I think 2 slides, maybe go back 2 slides. Because Jen said, yeah, with this influencer feedback, thank you. But Jen was talking about fostering the relationship between influencers and also working with local community folks who may not have the numbers. I want to talk a little bit about some feedback that we got from our influencers and go a little deeper into working with influencers, supporting them for a specific campaign for your health center. So the first thing is, I do want to be clear that our influencers are paid. Creating the content is a lot of work. You know, crafting a caption that's going to drive engagement, dealing with the engagement or managing the engagement afterwards. So responding to comments, deleting comments that are rude, breaking up arguments, things like that. And then also sharing at the end, because we didn't have access to their analytics. Then sharing feedback with us, sharing the feedback, sharing analytics, letting us know how the content performed on their site. So there is a lot of work that goes into it. The question over here about how would you measure from Lori, you have some great questions. How would you measure long-term changes in behavior with influencers? As someone who is a kind of a former influencer, I can say that the influence lasts, you know, the impact is long lasting. I have campaigns that I did 8 years ago that are still driving traffic on my site. I'm not working with that partner anymore, so they don't get any of that feedback. So if you're interested in looking at kind of a long-term overview, you could do surveys with your community and say, how did you find out about this? And make sure you have, you know, Instagram, TikTok, or whatever on there. You could re-engage the influencer and ask them, and by re-engage, I do mean, you know, pay them to go into their analytics and pull some reporting for you over the last, you know, however much, to see if there's been any other additional additional activities on the content that they've created for you, any comments, any feedback that they've received from their audience. So those are just some of the things that you can do. The other thing is you can share a tracking link with the influencer. So if you are having them come over to your health center's website, you can ask them, can you let me know? Or you'll have the tracking, you can look at the tracking and see how many people are clicking over. So those are just some of the ways that you can measure long-term impact. Some more feedback that we received from the influencers is making sure that the instructions are simple. They don't work for your health center. So make sure that the information that you give to them is pared down so that they're just getting what they need to be able to create on-point content. Graphics are helpful. We created some really awesome graphics with the help of NAC that they shared out, and we got feedback from the influencers that it went well. With that, also keeping in mind that each influencer has their own account. And so they may not want to take your graphic and put it front and center. Make it an option, not necessarily something that's mandatory. You're going to have naysayers comment. Influencers are happy to help and share information and disseminate really important content. They are happy to help. And then think through landing pages. This is one of some of the feedback that we got a lot of. Jeff, you kind of alluded to it when you talked about having the web page done. So I'm going to toss this back over to you, but just having a landing page highlighting relevant resources was one of the feedback that we got. So Jeff, in terms of from the center's side of things, can you think of one or two things that they can do in addition to the landing page to really make sure that the influencers, the work that they do has somewhere to go?
Yeah. I think what is really helpful is, in addition to the graphics, in addition to the landing page, um, I think really trying to communicate what I keep going back to this, but it's like, really, what does success look like? Where do you want people to actually be driven to? And how can I contribute in that, if that makes sense, right? So, I think a lot of times, when you're first working with an influencer, you are just like, oh gosh, like, they're going to be pompous, and they're going to be like doing all this dancing and doing all this stuff. And you'd be amazed with a lot of the micro influencers, they talk about this content anyway. We're actually passionate about this content anyway. So the more you actually can find the influencers that are already talking about this and follow them early on, and then whichever ones you actually vibe with, just at like a friend, like I could hang out with this person type level, those individuals are more likely to just be more passionate and advocate for it long after the campaign is done. Because I still talk about the Native American Health Center. I still am promoting and sharing their stories and all this stuff, because now I feel like committed to this, because I feel connected to that organization and that community health center.
Yeah, that's incredible. Thank you for sharing that, Jeff. That's a great point about the influencers then becoming your advocate or your ally. And so one last thing we wanted to talk about was, how do you measure results? So I'm going to pass that over to Jen, who will just share a little bit about how we were able to measure results and how you can look at how successful your campaign was.
Sure. There are multiple free platforms that you can use to measure results. There are, you know, you can, as Brandy mentioned before, look at providing unique links. Again, it really depends on the action that you're looking for people to take. In this case, we were looking at engagement. So we were able to follow the hashtag, follow the influencers, look at the posts that went up, and really look at who was commenting, how many comments did we get, and aggregate that information. And again, we use a paid platform to do this, but there are free platforms that will do the same and track a hashtag for you and bring that report together. I would say it is always incredibly enlightening to also ask the influencers for any additional data, for example, from their stories, but also the comments that you don't see. Because again, people will engage in stories and you don't necessarily get those comments when you export the information. And sometimes if it's a sensitive subject that people don't want to post a comment publicly and they just want to talk directly to the influencer and share their story or ask a question, those insights, when anonymized, are really, really helpful in kind of understanding what's happening behind the scenes, because there is more than what you see publicly. So I hope, and I know we're just about out of time, so I kept that brief. And there's a lot more in the documents that Ellen has just shared in the chat.
Oh,
In terms
Brandy, can I share one last thing?
Yeah.
Yeah, so I think also what community health centers can provide is the most surprising or most powerful data point that you want to share. Because when I found that like 87% of the people going to the hospital were kids, right? That is really impactful, not only to me, but all of my followers are like, we all care about kids. We all want to protect kids. We didn't know that. And a lot of times, influencers, we only have like 5 to 10 seconds to get someone's attention at the beginning. So, the strongest data points, if you can lead with that and give that to us, that is really helpful for us.
Yeah. Thank you. That's a really, really great. All right. I think we have time for maybe one or two questions.
Yep.
Yeah, we can definitely. Yeah, that's completely fine.
All right. So there was a question. How do you deal with staff who refuse to participate in anything fun? Our staff run the other way when they see us coming for anything social media related. Jeff, what do you think? What do you think?
Hey, I do not advocate for forced fun. If people do not want to play, the awesome opportunity of play is that there's a choice involved. So if someone doesn't want to play in that way, that's totally fine, right?
Mhm.
So, you know, again, this is all about experimenting and trying different things out, right? We don't have to do a coordinated dance to communicate our information just because everyone else is doing it. Like, actually brainstorm with your staff what would actually be engaging and fun and interesting to us. A lot of times, when they're measuring what's the most popular content on TikTok, it's either entertaining or educational. Those are the main things. So, and it can just be educational. It doesn't have to be always entertaining. So figure out what it is that you want to communicate, but definitely, don't force fun, especially if people do not want to do it. It's not fun.
No, it's not. It's not fun to watch either. Julia says, how do you find the influencers? So we did a mix of manually searching on the platforms. We got some great feedback from the centers. We had some community members reach out and say, hey, I saw that you guys are doing this campaign. Do you know this person? So, and then also we used a platform to do where we can search influencers. So that was a paid platform where we can search influencers by hashtag, by location, by engagement, and all that stuff. So it's a multi-dimensional approach to finding the right people, and it took time to find the 12 influencers we ended up selecting and to manage the 10 that we ended up with. Do you have? Oh, go ahead. Yeah.
I might also add, if there are any hashtags that you regularly use and others do as well, follow those. See who's engaging. That's a great way to get leads, I think, for potential partnerships.
And you'd also be surprised how much of your staff is on TikTok and on Instagram already that is already watching people that you could just ask, like, who do you like?
Yeah.
Who right now do you actually listen to?
Mhm.
And then start checking out their content to see if it's something that is the right fit.
Yeah. Yeah. And there might be people on your staff who can do it, who are interested in it. Like, put out an email and say, hey, we're going to be doing some more social media stuff. Does anybody want to take time on their lunch break to film a TikTok?
And I will say this, this is a story that happened during the pandemic. Most Gen Zers knew nothing about the Washington Post, had no idea what the Washington Post was or would pay attention to it. And they picked this one guy who would just play around on TikTok from the Washington Post account and made the most weirdest, strangest news article type TikToks that all of a sudden so many more people were actually paying attention to the Washington Post because of this one person being allowed to play in his own way.
Yeah. Other questions? Do you have sample contracts with influencers that you could share?
We can share kind of what the basic components that go into an agreement are. Absolutely.
Good. Thank you, Jen. Someone said we would like to discuss the role that the community health worker would play in this process. So with the community health worker, can you guys let us know when you say community health worker, who do you mean? Are those the folks who are working in the community center? Are those volunteers? Who are those folks? The name of the paid platform, honestly, Jen, do you remember the name of it?
There's Modash, but that's
Modash.
something I think we can circle back and put some examples, because I'd love to share also some super low cost and free resources
Yeah,
that you can use.
yeah, for sure.
Um, One thing I would say also about the question with respect to community health workers is, I think a lot of your teams, the individuals, especially those who are doing field work, probably have some amazing stories to share on social. And that could be pairing them with an influencer to do an interview to tell their story. But, I see, community health worker that goes to outreach sites to help support or provide resources or come to, okay, got it. I do think that there's a huge role for them to play, whether it's working with influencers on content, whether it's collaborating on a piece of content together. But hearing the stories of those who are in the field with community to share the impact that your work is having is incredibly powerful. Jeff, do you have anything to
Yeah,
add?
and I would add to that while answering this question of like, what are the strategies you have used to increase your followers? Just make really good content. And what I mean by like good content is content you like. Who cares about what everyone else wants, right? Think about what you like and you enjoy and what you consider a really powerful story, because then you actually start to find your voice online. The center starts to find their voice online. You're introducing people to a lot of the community health workers that are working those sites, and there's a relationship being built that way, and then the followers will come whenever they come. But paying attention to that, you'd be amazed how I know a lot of accounts that have hundreds of thousands of followers and a lot of not a lot of engagement, and you have people that have like 3,000 or 2,000 followers, but people care about that community and that account more and are paying more attention to that.
And they're also more willing to engage in comments, right? And take the full circle. You know, if
Exactly.
you're working with somebody who's a celebrity with 1 million followers, they're not going to answer any questions. You know, it's the smaller influencers who are invested
Yeah.
in the message, in the work, in the community.
And some of those micro influencers may not have ever been approached for a campaign. So they'll just be really appreciative that you're even asking them. So, enjoy that.
Next up, we see, what is the best way to sustain this as a nonprofit organization? Again, start small, work with people who know your community, who seem, and really look at their content to make sure that they are invested in, if it's not the same message, and it doesn't have to be, it has to be somewhat adjacent, right? They care about the health of their community in some way. And then, continuing to and then begin that collaboration, and we do pay influencers because they are experts in their community, but you don't have to start huge. You can start with 1 or 2 local influencers and build from there. And what I have learned over time is establishing these long-term relationships. If a creative partner feels invested, they feel supported, they do become evangelists over time, right? And this seeps into not just their social media posts. It may come into, community-based organization meetings and whatnot. So, there is a lot of power there in developing those relationships and not doing kind of, one-offs. I think we got through everything.
I will say one last piece about what Jennifer just mentioned is I think a lot of influencers want to help. They just don't know how, right? So I think when you could build a relationship over the next like 3 to 6 months with an influencer where you're like, just come to the center, film content the way you would typically film your content, and we can like figure out, you could actually even show me so I can start making TikToks myself or Instagrams myself, and just start um understanding what their motivations are and what your motivations are. And the more, because we want to have an impact already, that's why we're making a lot of the content that we're doing. And the more we can actually help organizations and community health centers like yourself, the more that just makes us feel good and also allows us to, have the impact that we've wanted to always have.
And I think we're definitely at time, if not past it. But if there are additional questions for myself, for Brandy, for Jeff, please share them. We would be so happy to answer them afterwards offline. And I'm sure Ellen and team can get those questions to us. So I would love to just thank you so much, everyone, for joining us. This was a great conversation, and your questions were incredible. Yeah, and Ellen, I will turn it back to you in case you want to close.
Thank you. I see, a bunch of thank yous, and I know this was a pilot that we did. This was an idea we had, and people have come before the call and during the call and said, we want to come on board. How can we do this? We need help from NAC. We need help with buy-in. And so the response has been significant, and we're looking into doing another micro influencer campaign with different sites. But then also, I know someone just put in, we need another hour instead of a 1 hour because there's calls. We're looking into working with Gebin in the future to kind of, be able to offer an office hour for health centers, because I think that would be helpful. I know people also love hearing from Jeff and hearing, because you're so approachable, like, how to do that. So I think this is one of our hot topics. this is just the beginning, and we're thrilled that you're interested in this influencer marketing. So please stay tuned. We will follow up in about a week or so with the recording from the webinar, the PowerPoint, and all of the new materials I put in the chat, and some other resources that you can hopefully sell to your organization. In one of the documents, it has my email address. So if you have any questions about influencer marketing before we figure out our next steps, please feel free to email me, and good luck in social media.